Parents often notice their little ones tugging at their ears, and it can be a real head-scratcher. Is it just a curious habit, or is something more serious going on beneath the surface? Understanding what other signs to look for alongside ear pulling can really help you decide if it is time to check in with a doctor. When a child pulls at their ear, especially when they are too young to verbalize discomfort, it can certainly be a signal of an ear infection. However, it is usually not the only sign. Look for additional symptoms like fever, fussiness, difficulty sleeping, decreased appetite, and fluid draining from the ear, as these often accompany an ear infection, pointing towards a middle ear infection called acute otitis media. Ear infections occur when bacteria or viruses get into the middle ear, the space behind the eardrum. This area normally drains fluid through a small tube called the Eustachian tube, which is often shorter and more horizontal in young children than in adults. When this tube gets blocked, perhaps by swelling from a cold or allergies, fluid can build up, creating a perfect breeding ground for germs. This buildup of fluid presses on the eardrum, causing pain and making a child want to pull at their ear. The inflammation and infection can also trigger a fever and general malaise. If you notice your child pulling their ear, take a moment to observe their overall behavior. Check for a fever using a thermometer. Listen for changes in their cry or increased irritability. Offer them food and drink to see if their appetite is affected. Gently check for any discharge coming from the ear, which can be a clear sign of a ruptured eardrum. Documenting these observations can be incredibly helpful when you speak with a healthcare professional. An interesting fact is that ear infections are one of the most common reasons young children visit the doctor, with many experiencing their first one before their first birthday. The medical term for this common issue is acute otitis media, or a OM, while ear pulling is a classic sign. Babies and toddlers might also rub their ear against a surface or even hit their head to try and relieving pressure. Sometimes, a child might also experience temporary hearing loss during an ear infection due to the fluid buildup, which can impact their response to sounds. By paying close attention to these accompanying symptoms like fever, fussiness, and changes in eating or sleeping patterns, alongside ear pulling, you gain valuable clues that can help you and your doctor quickly identify a potential ear infection. This proactive observation empowers you to seek timely care, helping your little one feel more comfortable sooner and promoting their overall well-being.